Hey guys, welcome again. Facebook was having some technical difficulties. They waited till I connected all the way, then told me my connection was weak. But again, just an introduction. I am Dr. Bear, your board certified internist, founder at drpeersblog.com, author, speaker, and soon to be podcaster. We're definitely have that in the mix, working on the background. So I'm definitely excited to kind of bring that to you. And today I wanted to talk about heart disease. I wanted to focus on it for a whole bunch of reasons. First and foremost, if you don't know, it is February, and February is actually recognized as American Heart Month. So what better time to talk about heart disease than now? Hello, Maria. Hey, Maria, how you doing? Hey, everybody for joining. Thank you for joining the live broadcast. Go ahead and share, like. Today we're going to be talking about heart disease and pretty much why it's important for us to really be thinking about this on a consistent basis. Again, I am your favorite internist, Dr. Barry, and let's to kind of first and foremost start out. Heart disease is the number one killer in men and women, right? So if that's not enough to kind of get the conversation started on why this is important, hey Amanda, if that's not important to get the conversation started, let's start there. Number one killer in the world, heart disease. And when we look at the numbers worldwide, heart disease and subgroups under heart disease makes up, I think, 3 or 4 of the top reasons why for in terms of causes of death in the whole world. So this isn't a regional thing. This isn't a United States thing. This is across the board, everywhere you're at. Heart disease is a number one killer for us. We know specifically men and women tend to be affected at very similar rates, as they get older. Women tend to have a little bit more protective barriers, and that's more due to hormones, specifically estrogen. But we know once they get to a certain age, men and women tend to suffer from disease at an astonishing rate, which is extremely concerning. Being a primary care physician, I tend to see patients pretty much at all, kind of stages and walks of life. Because of the many risk factors that heart disease kind of plays a factor in, and we'll kind of go over those diseases. But because I've seen them from point A to point Z, we definitely are really trying to put a premium focus on trying to prevent risk factors that we can, because there are some risk factors that there's nothing that we can do about, but the ones that we can actually make some changes, we're definitely, and you'll see, especially if you're guys who may be seeing doctors elsewhere, we definitely stress it a lot. We may seem like we're being overly aggressive, but it's because we know in the long run, if we don't do anything now, some of the problems that can arise. So let's just talk about, again, heart disease and just heart disease in general. We know heart disease is a disorder of blood vessels in the heart, and which can lead to what we commonly known as heart attacks. But when I like to think about heart disease, I understand that not only can heart disease affect the heart, but in the vessels in the heart, but you got to figure there's vessels in the kidneys. You got to figure there's vessels in the brain as well. All of these things seem to be very interconnected when we're talking about heart disease. So even though we tend to focus, a lot of our focus is on heart attacks, we understand the fundamental process is the fact that we have blood vessels that get clogged for various reasons. Blood vessels that lose blood flow in parts of the heart that lose blood flow for various reasons, and which we'll kind of discuss. And the goal is, how do we try to prevent that or minimize the damage that we're experiencing? And again, like I talked about, with women tend to have a very protective a marker, which is our estrogen. Estrogen tends to protect women at earlier ages, but once they get past the age of 50, and their the estrogen levels are pretty much subpar or done because of menopause or whatnot, their risk factors increase and tend to get back to the same level as men. So we're definitely have a focus where most of the talk and most of the stuff that you may read may always be focused on the men in terms of heart disease, but definitely we have to think about women as well, as far as in this disease course and disease manner. in that regard. So that's why it's extremely important to make sure that, you know, we're being very mindful of how they can present and why they can present the way they present, because men and women do present differently for the same disease. So let's talk about some of the risk factors when we talk about heart disease. The biggest one, high blood pressure, or blood pressure in general, but high blood pressure specifically is a huge risk factor for a person suffering from heart disease. And again, blood pressure, and we've talked about this before, blood pressure is one of the, what I like to call a silent killer. And reason being is that because there's usually no side effects from it. Like, I have patients who come to my office, their blood pressure is through the roof, and they feel no different. And the reason why they feel no different is because our bodies do such a great job at dealing with the intense pressure over and over and over again that nothing really kind of comes into play. But unfortunately, once our body gets to a point where it can't do anything about it, that's when the problems arise. So our bodies can walk around from a normal, just talk about normal blood pressure. We can, average person, top number, we'll just say top number, below 140, bottom number below 90. But I have a lot of patients who they're walking around, their blood pressure is the top number is 150, 160, 170, and they feel no different whatsoever. Because our body do such a good job at dealing with that high blood pressure. Now, on the outside, it's doing a good job. You don't feel any different. But on the inside, where you know, heart disease is starting to. What's going on? What's going on, Gino? I appreciate you for joining the live stream. We're talking about heart disease today. We're talking about our risk factors. First one, high blood pressure. So again, going on with high blood pressure, even though, you know, you may not feel any symptoms, we know heart disease starts to build up. We know kidney disease starts to build up as well. And once you get to the point where your body can't deal with the blood pressure, that's when problems arise. And when I say problems, that's when you get the heart attack. That's when you get the stroke. That's when you get kidney disease. That's when you start having vision issues. That's when you start having lung issues. All of these problems, like, you know, hit you all at once. Once the body says, you know what? You know, I've done enough. I've been dealing with this high blood pressure for years, and, you know, no one's helped me out. So here I am today. So that's why, again, in the office, you know, we're very, 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 vocal about making sure your blood pressure is good, making sure your blood pressure stays good. And just on a quick caveat for my patients know, when you come to the doctor's office, when you go to the doctor's office, please take your blood pressure medication before you get there. That's a very common thing that I see a lot, where for some reason patients don't want to take their blood pressure medication right before they go to the doctor's office. I don't know why they do it. Let me let you know now that you can go ahead and take your blood pressure medication. There's not a doctor who does not want you to take your blood pressure medication before it starts. So go ahead, take your blood pressure medication before you get there. So that's blood pressure. Number 2, diabetes. Diabetes and even pre-diabetes puts you at an increased risk for having heart disease later on. And remember, we talked about heart disease being almost an old person's disease. So again, you could be dealing with these diabetes for years and not have any issues from a cardiovascular standpoint, but then end up having problems arise from that. So definitely be extremely careful for my diabetics and my pre-diabetics. And the worst thing about my pre-diabetics and my diabetics is that they tend to feel differently, right? So they don't feel the same pain, discomfort, the same elephant on my chest that a person without diabetes has. So I definitely get very mindful whenever my diabetic patient starts telling me any complaints around here, around their chest. When I'm talking about reflux, GERD, like, you know, just discomfort, I'm a little bit more aggressive in that regards, because I know they're not feeling the same. People with hypertension need to be concerned. So people with hypotension don't pose an increased risk for having heart disease, but what actually, especially what you mentioned, Amanda, is that a family history, and that's my next point, a family history of blood pressure is a risk factor for having heart disease. So you can be, you know, a triathlon athlete, you can work out every day, eat great, but if mom, dad, grandma, grandpa has blood pressure issues, if they have diabetes issues, we know you are at an increased risk for having heart disease. Again, I think I talked about it earlier. I have a patient of mine who is 30, I think he's like 37, 38, and he ended up having to get triple bypass surgery. So he ended up open heart surgery because he's a weightlifter, he works out, he does everything he was supposed to do, but he ignored the fact that his family was a whole bunch of overweight, hypertensive, diabetic folks in his family, and like the genes kind of pass it along. So definitely think about the genetic component. One thing that again, family history. We talked about age as well being an issue. Yes, the next one, cholesterol. High cholesterol also poses an increased risk for having heart disease. Because again, when we talk about the heart attack, when we talk about the stroke, all that is for a period of time, I got less blood flow to a certain area. And usually what causes that less blood flow is one of those plaques of cholesterol that's kind of been sitting in that artery, that's been sitting in your heart, sitting in your neck, flies up, and then all of a sudden that area of the brain, that area of the heart gets no blood flow, and then bam, that's when we have problems arise. So high cholesterol is another thing too. And high cholesterol, just like high blood pressure, symptomatically causes you no problems, right? I got people walking around here, cholesterol's through the roof, but they don't know it. One, because they don't feel no different. It doesn't cause them to feel bad. And again, this isn't a thing where like they just eating really bad. They don't have to eat really bad. If mom had high cholesterol, dad had high cholesterol, and the genes just kind of got passed along, now you have high cholesterol too. So nothing, even regardless of, and again, I always try the diet. Like my patients know, I always give you 3 months. If you walk into my office and your sugar's a little bit on the high side or your cholesterol's a little bit on the high side, so all right, we got 3 months. Let's see what we can change with the diet, and then you're gonna come back. If these numbers are still high, we putting you on medication. Like that's I give them 3 months. I give all my patients about 3 months when I can. If your sugar is like way too high, if your cholesterol is way too high, and I already know that a diet's not going to change those numbers, then I just start you with the medication right off the bat. But if I know you're kind of on that borderline, like maybe if you exercise a little bit more, eat a little bit better, that's enough to kind of push you back over to the healthy side, then I'm okay with doing that too. So definitely high cholesterol. And again, the stuff I name are unfortunately stuff that you really can't change, right? Like you can kind of try to adjust having high blood pressure, but if you have high blood pressure, you have high blood pressure. You can try to adjust, from having diabetes, but if you got it, you got it. You can try to adjust if you have cholesterol, but if you got it, you got it. The men, especially the men who are watching, just being a man makes you at a higher risk for having heart disease. Now, we talked about once women get up to age, once they get to about 50, 55, it's about even, but up until that point, if you're a 45-year-old man, you have a higher risk of having heart disease. You have a higher risk of having a stroke, a heart attack, and everything up and above from that regards. People with patients. Yeah, so a very, very good point. So people with hypertension, and there's really, even though it is hypertension, it's really for the coronary artery disease, the heart disease aspect of it. We always recommend taking a baby aspirin. One, because we know a baby aspirin, clinically, unless you have like some bleeding issues, really not going to cause any problems. But we know it's been known to save lives. Just taking a 81 milligram baby aspirin, call it a day. Because again, if you're a diabetic, you should be taking a baby aspirin. If you're a hypertensive, you should be taking a baby aspirin. All of these things that we know, if you're at a higher risk for having heart disease, you should be having a baby aspirin right along with it. And then even from a medical standpoint, like the government, right? The government even like puts little check marks on from a grading system and say, hey, Dr. Pierre, you got 20 patients who have high blood pressure, but only 15 of them are taking an aspirin. What's going on? So, I get letters like that, like weekly. So, definitely a baby aspirin is extremely important. And that's more of a preventative. Everything that we do is more from a preventative standpoint, because we know there's only so many risk factors that I can change. So let's talk about the stuff that I can change, or stuff that I can tell you to do that you could possibly change. So before we talked about what, stuff that you may have a risk factor that you really can't do nothing about because it's just genetics, in terms of like age, gender, whether you're hypertensive, whether you're diabetic, whether you have high cholesterol. So now let's talk about the stuff that you can possibly change to decrease your risk factors. The big one, right, is smoking. Like if in 2017, right, let me put my guys up. In 2017, if you're still smoking cigarettes, then honestly I don't know what to do, right? Honestly, I don't know what else to do. Like if you're still, like, with all of the evidence that's out there that says stop smoking cigarettes, If you're still smoking cigarettes, again, I really don't know what to do. Again, and you guys know my take, right? I'd rather you smoke marijuana. Like, I'm gonna just be honest, right? If you told me, hey doc, like, smoke cigarettes, smoke marijuana, what should I do? I'm gonna tell you to smoke marijuana, because we know all of the problems with cigarettes, right? We ask any medical student, pre-med student, nursing student, like ask anybody in the health field, if they got a test question that, person has cancer, person has so-and-so disease, what's one thing that you could tell them to do that can decrease their chances? If smoking is an answer choice, smoking is that answer regardless, right? Like, I don't even need to read the rest of the answer choices. If I tell that person stop smoking, I'm going to choose that 100% of the time, right? So in 2017, if y'all are still smoking cigarettes, I don't know what to do for you, honestly. So, like, the one big thing you can do to change your risk for having heart disease that we know you can actually control is stop smoking. Number two, if it's possible, being overweight. So we know the heavier you are, the more likely, and again, this is going to be a very common thing, which of course is something that, I deal with in my practice. I deal with personally on a personal level all the time, right? We know the heavier you are, the more likely you are having a risk for heart disease, right? So, if you can, work on your diet, that's something else that we know that you can kind of change to try to prevent heart disease later on. Again, that's why I always tell, that's why I always give my patients, especially the ones who are borderline, about 3 months. I give them 3 months to say, hey, you know what, change your diet and let's, exercise a little bit more. Let's see if we can, get to the bottom of it. But, that's pretty much, so diet's another one, right? Being more physically fit as well, because we know a more physically fit person is least likelier to have like heart disease. And when I talked about my patient, earlier, the 37-year-old, I think the only reason why like he was able to survive, like, his endeavor, being 37 with a triple bypass, is because he was so fit. Like, if he wasn't as fit as he was, I'm not sure what would have happened. I think because he had a major heart attack. And, fortunately, he was able to recover, and he's doing very well because of it, because he was so fit. So now, and what is actually a true story, he's actually going to, and I've encouraged him, he's actually going to start, speaking out to, to the gym crowd to make sure they're getting their butts into the doctor's office as well, because it's important. Like my gym folks, side note, never think that they have any medical problems with them, and they're so hard to get them in the doctor's office anyway. So, shout out to my gym folks, but he's definitely gonna be a champion for folks in the gym to try to get them get them to see the doctor from a standpoint there. And I think, that's really the biggest ones from a risk factor standpoint. We talked about, and just from a recap standpoint, so we talked about, why we're doing this. Again, February is, American Heart Month just across the world. We know heart disease is the #1 killer for men and women worldwide, not the United States, not Florida. Worldwide, heart disease, #1 killer. And we talked about some of the risk factors. So we talked about what we can change and what we can't change. So some risk factors that we can't change. #1, if you're male or female, because we know men have a higher risk of having heart disease than women. Another thing you cannot change, if you have hypertension. If you have, another one is diabetes. Another one is high cholesterol. Those are some big things, because really your genetics. Those are some things that you really can't do nothing about. We just got to try to minimize the risk factors as much as we can. And now we talked about the things that we can change, and that, this is where, your physician, earns his pay or whatever, because he really tries to make sure we hit home on that. If you're a smoker in 2017, stop. Like, I don't know. I don't even really need to go into any further detail. Just stop smoking. Like, if you're still smoking in 2017, please stop. Just stop. Let me see. We talked about diet, because we know diet's a big factor as well. So if you're overweight, but again, like I always do, you don't have to be overweight to have heart disease. Trust me, there's a lot of skinny people with heart disease. But being overweight does not help. So if you're overweight, work on that from a dietary standpoint. Start becoming more physically active as well. because again, that's extremely important. You know, the more physically active you are, the least likely you are to have heart disease, and the more likely you are to like survive if you do have heart disease if you're more physically active. From that standpoint, there. So you know, go ahead and go to your doctors. You know, if you have not had your checkup yet, go ahead and get that checkup. You know, check your blood pressure. Go to your local grocery store. We're not gonna name them on here, but you know, whatever your local grocery store is, go to them. You know, stick your arm in the place, see what your blood pressure numbers is looking like, because we know your blood pressure could be super high and you not even know it. We know your cholesterol could be super high and you not even know it. Diabetes is a different thing, but you know, at least those two, we know they can be extremely elevated and you not have any symptoms whatsoever. So you know, please you know, take this month on. Again, you're gonna see a lot of advertisements and CDC and all, American Heart Association, all these people really kind of pubbing, check on the heart, work heart disease, because it's important. It's there's really no two shakes about it. And if you have not had a chance, like we always end this, go ahead and check out drpsblog.com. This video will be up later today on the blog website as well. I'll put that up later today for some viewing pleasure, as well as it'll be on my Facebook page if you're not watching us on Facebook. You guys have a great and blessed day. I will see y'all next week. We're not, again, like always, we're not sure what we're going to talk about. We're going to talk about something, to kind of get you going. And, thanks you guys for joining the Lunch and Learn with Dr. Bear. Bye.